2/3 of Welsh human beings include no one to say to on their psychological public health concerns. On to crisp study of period to changing Wales, a association of 3 psychological public health charities, Reason Cymru, Hafal and Gofal. On period to say date, they are hopeful human beings to outdoor up on their difficult situation. There, Bethan Robe, 30, of Caerphilly, explains how not creature capable to say on her psychological public health state leftward her misdiagnosed, in isolation of job and needing to get her own lifetime. For largest youthful human beings, the begin of their career is a period of emotion. But for me, in an undiagnosed psychological public health state, it didn't rotate out love how. The moods I had ever struggled in came to the shallow. Elderly 22, I was work for a click agent in Cheltenham, written click releases and backup for websites. It was top pressured and needing, in tightly deadlines and a big workload. Still, in spite creature skilled for it and agitated by it, it became precise I was fighting. I stored receive over in tasks and creature suppressed by the workload. Associate charged me of dream at my desktop and creature stray and incapable to concentrated. While bosses tested to offer me feedback loop, I would break and burst into tears, or get really emotion and irate. The job location became more intolerable and following 18 months I leftward. I excited behind to Cardiff to dwell in my parent and provided else part in social relations. But the identical item happened and I began to get over. Bosses requested me why I was fighting and I just couldn't speak them. But since I knew I might be fired once again, I became extremely concerned. I felt those guilty and panicked, but largest of all I felt powerless. One day more than, I would cry at the slightest bit of feedback loop, or at some times, I became maniacal, making 100 things at one day. I went to the physician, who undiagnosed concern and depressive and put me on against depressants. But they'd done me drowsy, and my job location was so lively, I couldn't be located and was constrained out of how job too much. By the spot, my trust was destroyed and which had deployed in my job lifetime now spiraled in my private lifetime too much. My parent were embarrassed, not insight why I couldn't conduct downward a work. My length-term affiliate at the period as well ended our relation since he couldn't manage in my unstable moods. I felt too shamed of how I was sensed to say to human beings, and I mind how if I did, they would see me as poor and inept. I had suicide thoughts and outbursts wherever I would cast material, dig my nails in my wrists or shout in the cushion to produce my wrath. It felt love I would never be the man I requested to be and I didn't know which was incorrect. Eventually, things came to a chief in October 2017. By later, I had a new young man but one date, for no cause, I fair blown in front line of him. Down there was no flop, down there seldom is, but I felt so strongly desperate and pathetic I said him I didn't wish to dwell any more then. As I examined it, I didn't fit in, so which was the spot of creature about? Vision how mad I was, he done an disaster assignment in a various GP and insisted on upcoming in me. How physician said me I should never include been on against depressants and how instead of unnecessary sentiment stabilizers. A psychologist I was called to later undiagnosed frontier identity disturbance, differently named as emotion insecurity. I had never heard of but while I looked up the symptoms, I had them all. They turned on fighting to support steady relationships, possessing suicide thoughts and intensive tension how would changing quickly. Later down there was operating impetuously, sense paranoiac and affliction intensive outbursts of wrath. Read the listing of symptoms, I felt a wavelength of ease, since I had ever felt down there was more than to it. But I was as well amazed, since it had lost on for so length, how had no one spotty it up? With my proper diagnostic, I include been put on sentiment stabilizers and lifetime is lot superior. I've provided a new job in the Mercy segment and my bosses, aware of my diagnostic, include been extremely supporting. Vision a psychologist and advisor include as well helping, as has take up fleeing, as I discover the much reduces concern. But importantly, I am now eventually capable to say to human beings. I newly said my top boyfriend all and she told she was so lightweight I'd eventually speak to her. She had named thing was incorrect but fair didn't aware how to assist. Since of the significance of the, I be a defend for period for changing Wales, a association promotion psychological public health learning in working area to end stigmatization and discrimination. On their period to say date, I would fair love to promote human beings who aware down there is thing incorrect in their psychological public health but dong t definitely aware which, to hold speaking before they discover who can assist.